A startling revelation has emerged from a recent Gallup poll. Americans' perception of their mental well-being has plummeted to an all-time low. But is this a cause for alarm or a sign of progress? The poll reveals that the percentage of Americans who rate their mental health as excellent has dipped below 30%, a first since the pandemic's onset. Moreover, the combined percentage of those who rate their mental health as good or excellent has sunk to a record low of 72%. This downward trend began during the COVID-19 pandemic, a stark contrast to pre-2020 figures, where over 42% consistently rated their mental health as excellent. Here's where it gets intriguing. Experts suggest this decline might not be entirely negative. David Radley, a senior scientist at the Commonwealth Fund, believes the increased openness about mental health issues has encouraged Americans to be more honest about their struggles. He argues that this willingness to discuss mental health is a positive step. Dr. Lisa Rosenthal, a psychiatry professor, echoes this sentiment, suggesting that the numbers might indicate a reduction in stigma and an increased awareness of psychiatric symptoms. Social media platforms have played a role, with more adults recognizing that lifelong challenges could be linked to treatable mental health conditions such as bipolar disorder, complex PTSD, autism, and ADHD. A white paper from Fair Health confirms a significant rise in mental health diagnoses since 2019. While some conditions, like generalized anxiety and major depressive disorders, may be pandemic-related, others like ADHD and bipolar disorder are understood to be lifelong conditions. The COVID-19 pandemic's trauma, political uncertainty, and economic instability have undoubtedly impacted Americans' mental health, according to Radley and Rosenthal. However, they also agree that reduced stigma has played a role in more people seeking help. Dr. Rosenthal offers a nuanced perspective, acknowledging that not all unhappiness requires treatment and that some reactions are normal, even if unpleasant. She highlights societal issues, including politics, as significant contributors to unhappiness, especially for immigrants facing high stress levels. Interestingly, the Gallup poll reveals that self-reported mental health has declined more significantly among groups typically reporting higher mental health ratings, such as college-educated adults and Republicans. The number of Republicans rating their mental health as excellent decreased from 53%, 2014 to 2019, to 40%, 2020 to 2025, bringing them closer to Democrats. This shift is surprising, as people often report better mental health when their political party is in power, yet both survey periods included Democratic and Republican presidencies. College graduates also showed a notable decline, with a 17% drop in those rating their mental health as excellent, aligning them more with non-college educated individuals. Dr. Rosenthal interprets this as a sign of increasing unhappiness across all educational backgrounds. She further suggests that Americans are not only facing uncertain circumstances but also experiencing a breakdown in civility and discourse, leading to a sense of disconnection and altered community belonging. Despite growing polarization, the poll indicates that Americans' mental health outcomes are becoming more similar. Radley concludes with a thought-provoking statement, implying that the challenges Americans face are universal, and the impact of these challenges does not discriminate. And this is the part that sparks debate. Are Americans truly more unhappy, or are they simply more willing to acknowledge and address their mental health struggles? Is the decline in self-rated mental health a sign of societal progress or reflection of the tumultuous times we live in? Share your thoughts in the comments below.